Into AWANI tonight with me, Cynthia Ng. Government allows walk-in vaccination for above 60s in the Klang Valley. And first full parliament sitting of the year in September. That's coming up. The government will allow those aged 60 and above to walk into any GPs participating in a national immunization program to get vaccinated. Health Minister Dato Sri Dr. Adam Baba said this pilot program will begin in Selangor and gradually be expanded to other states. He, however, has yet to reveal when the pilot program will start.
Kita buat pilot dulu di Selangor, iaitu more than 60 years old, untuk mendapatkan vaksin secara walk-in, kerana ada lagi data menunjukkan mereka yang berumur 60 tahun ke atas masih lagi belum mendapatkan vaksin.
He also said that more than 3,000 clinics in Selangor and Kuala Lumpur would participate in the vaccination program. Each GP, he said, will be able to administer approximately 100 doses of vaccine per day, which translate to some 300,000 doses a day. At present, 700 general practitioners are aiding the vaccination efforts in Selangor and KL. Dr. Adam also announced that industrial vaccination centres are allowed to operate on a 24-hour basis in states including Selangor, Kuala Lumpur and Negeri Sembilan in an effort to ramp up vaccinations within the Greater Klang Valley. Another record number today. The country reported 13,215 cases, the highest since the pandemic began. A total of 110 fatalities linked to COVID-19 was also reported in the past 24 hours. Selangor led with the highest number of daily cases with 6,120 infections, followed by Negeri Sembilan with 1,603 cases and Kuala Lumpur with 1,499 cases. Meanwhile, Health Director General Tan Sri Dr. Nur Hisham Abdullah warned of the highly infectious Delta variant, saying it can infect from person to person within seconds of exposure. He said in the past, a person can get infected over a duration of 15 minutes through close contact of less than 1 meter. The government is mulling the possibility of giving leeway to those who are fully vaccinated against COVID-19. According to Prime Minister Tan Sri Muhyiddin Yassin, this includes allowing people to dine in at restaurants and to travel interstate.
Akhir sekali ialah saya telah minta jawatankuasa pengurusan ni untuk menilai semula bagi mereka-mereka yang telah dapat vaksin 2 suntikan, supaya mereka akan diberikan kelonggaran, ya, sama ada dari segi perjalanan ataupun pergi ke kedai ataupun makan di restoran. Ini petanda supaya kita nak menunjukkan bahawa sementara kita menguruskan COVID, maka kehidupan rakyat mungkin sedikit demi sedikit akan kembali seperti masa-masa yang lepas. So these are the initiative forward. Dan tempoh jangka masa ikut pelan pemulihan itu hanya sehingga akhir tahun.
He added that the national COVID-19 immunization program is running smoothly, as he called on all quarters to put their trust in the government to handle the pandemic. The first meeting of the Dewan Rakyat for the 4th term will be held for 15 days from 6 till 30th September. Dewan Rakyat Speaker Dato Azhar Azizan Harun also informed of a second meeting of the Dewan Rakyat for the 4th term, which will be held for 32 days from 25th October to 16 December. He added that the Dewan Rakyat will also issue a notice immediately to all members of parliament about a 5-day special seating from July 26. The announcement came after repeated calls for parliament to reconvene to discuss measures on the health and economic crisis caused by the COVID-19 pandemic.
More than a year into the pandemic, SMEs are on the brink of collapse, with many having less than a month left of cash reserve to survive. Chairman of Small and Medium Enterprises Association, Dato William Ng, shares the plight of this group amid the nationwide lockdown. He calls for urgent action by the government to save the SMEs.
The SMEs has essentially run out of money altogether. The wage subsidy, I think, has helped a little bit. But unlike last year, where some SMEs can still pay salaries, this time around it is really, really bad. So in our own survey last month, 30% of all SMEs say they have less than 1 month reserve This is actually the same as what the Ministry of Entrepreneur Development and Cooperatives has said last week, where as many as 580,000 businesses, or almost half of all our SMEs, would collapse by October if there's no further help given. So I think the situation is really bad this time around. There's so much call from the Rakyat to say, if you're on a lockdown, you lock down properly. We understand that. But what we are trying to say here is that people must understand that after 1 year in lockdown, it is no longer about choosing lives and livelihood. The two are so interconnected, right? For example, as people lose their income, they also become more desperate. And this results in even more people not following the SOP. And then the cases go up. So it's interconnected. So we feel very strongly at Samantha that if the government is to allow, number one, as soon as possible for businesses to reoperate again. Number two, if they're to allow that, then there should be no discrimination whatsoever whether a business is essential or non-essential, right? We cannot be so arbitrary and say what is essential, what is not non-essential. If it is safe to reopen one sector, I think there's no reason whatsoever for other sectors not to be reopened unless it involves very specific risk.
William stressed that SMEs should be vaccinated promptly and that clearer SOPs should be in place in order to avoid their violation.
We should actually speed it up so that as many or as soon as possible, the industries can be vaccinated so that business can be reopened. I think that's what the SMEs want more than anything else. And secondly, of course, if you have to allow businesses to operate, right, be clear about the SOP. Every day now we have members complaining to us that they are being fined 10, 20, 50,000 for the smallest infringement. For example, they say, okay, you do not have this, what they call it, tape as you enter the shops or you enter the factories, you don't have this kill tapes, something like that. So it doesn't mean that the SMEs or the workers are not following the SOP. It is just because they don't have the tape and they're fined 50,000. So I think this is something that the government should actually ease off on. Be a bit more considerate, be a bit more passionate, or not passionate, compassionate to our SMEs who are already struggling.
We will take a short break. Stay with us.
Maka lebih sukar untuk COVID menjangkit kita.
Untuk tempoh 2 minggu ni duduk di rumah. Kalau kita boleh laksanakan PKP Kendiri dan keluarga,
Saya kira insya-Allah kita boleh berjaya. Akhirnya kita menang.
Perang COVID-19 masih belum berakhir. Dalam kita berusaha memutuskan rantaian wabak ini, kita jangan terpedaya dengan virus maklumat palsu. Simak fakta melalui www.astroawani.com atau aplikasi Astro Awani. Teruskan berdisiplin, ratakan lengkungan pandemik ini.
The third wave of COVID-19 has taken us by storm. There's no room to take anything lightly. Everyone must follow all the steps to stop.
Facilities deployed fresh graduate doctors and nurses to treat COVID-19 patients and imported treatment drugs and oxygen. Indonesia is struggling to slow virus transmission even after imposing its toughest COVID restrictions so far. The Philippines, Saudi Arabia, the UAE, Oman, Taiwan and Hong Kong have all announced a ban on travelers from Indonesia for the rest of this month over fears of the quick-spreading Delta variant. Australia's second most populous state, Victoria, will enter a 5-day lockdown following a spike in COVID-19 infections, joining Sydney as both economic hubs battle an outbreak of the Delta variant. This is the 5th time Victoria has entered into a lockdown.
You only get one chance to go hard and go fast. If you wait, if you hesitate, if you doubt, then you will always be looking back wishing you had done more earlier. I am not prepared to avoid a 5-day lockdown now only to find ourselves in a 5-week or a 5-month lockdown.
The decision by Victoria means that about 40% of Australia's population is now under a stay-at-home order. Melbourne had largely avoided new cases despite an outbreak in the neighbouring state of New South Wales. But earlier this week, a team of furniture movers travelled from Sydney to Melbourne, leading to a spread in cases. The latest outbreak brings the total number of cases there to 18. At least 33 people have died and many more are missing following severe floods in western Germany. About 70 others have been reported missing after houses collapsed following hours of torrential rain as more homes are expected to cave in. The flooding is concentrated in the wine-growing hub of Achweiler after the Ach River burst its banks, bringing down the houses. Rail and road transport were disrupted and shipping on parts of the Rhine River, an important trade artery, was suspended. The German Weather Service has warned that southwestern parts of the country could expect heavy rainstorms on Thursday and Friday. Several countries in Central Europe have been hit by flooding in the past weeks after heavy storms swept across the continent. COVID-19 has led to disruption in healthcare services last year, resulting in 23 million children worldwide missing out on routine vaccinations, 3.7 million more than in 2019. Official data published by the World Health Organization and UNICEF found that 17 million of these children did not receive a single vaccine shot in 2020.
As countries clamour to get their hands on COVID-19 vaccines, more children are being left at risk from devastating but preventable diseases like measles, polio or meningitis, said WHO Director General Dr. Tedros Adhanom Ghebreyesus. Routine child vaccination services were most severely affected in Southeast Asia and the Eastern Mediterranean. The organizations warn of a widening of an already immense inequities in vaccine access. Compared to 2019, 3 million more children missed their first measles shot and 3.5 million more children failed to receive their first dose of the DTP1 vaccine, which offers protection against diphtheria, tetanus and pertussis.
Thailand opened 3 more islands to vaccinated tourists today, despite a nationwide surge in COVID-19 cases fueled by the Delta variant. Koh Samui, Koh Tao and Koh Phangan welcome visitors as part of the country's push to revive its battered tourism industry.
Thailand launched its sandbox scheme on July 1st, allowing vaccinated travellers to visit Phuket Island without quarantine in a hotel, but they are not allowed to leave Phuket for 2 weeks. Under Thursday's expansion, tourists must stay at an approved hotel on Samui for a week and can leave their accommodation on day 4. They will have to produce a negative COVID-19 test before being allowed to venture to Tao or Phangan after their first week. So far, 75% of residents on the 3 islands were vaccinated. Meanwhile, the rest of the country is struggling to rein in infections from the Delta variant, which authorities say now makes up nearly 80% of its caseload. Virus hotspot Bangkok and 9 provinces are under tightened restrictions as the country records almost 9,200 new infections and a record daily high of 98 deaths on Thursday.
Tonight on Consider This, we take a closer look at Hong Kong. Since the 2014 umbrella movement, the world has witnessed Democrats in Hong Kong battling Beijing's might. But has the pandemic and a new security law all but silenced this global city? We speak to Victoria Hui about Hong Kong's future. That's coming up on Consider This. And that is all we have for you on AWANI tonight. Get the latest news updates on COVID-19 and COVID-19 vaccines from astroawani.com and Astro AWANI app. I'm Cynthia Ng. We'll see you again.